NCC Electronic Fetal Monitoring Certification PDF Download Practice Questions. Question 1. Primary benefits associated with the use of standardized terminology for fetal heart monitoring interpretation include: Option A, enhanced communication among healthcare providers and promotion of patient safety. Option B, increased nursing time at the bedside and enhanced patient satisfaction. Option C, increased likelihood of correctly diagnosing fetal acidosis during labor. The correct answer is option A, enhanced communication among healthcare providers and promotion of patient safety. Question 2. A patient presents with a small amount of thick dark blood clots who denies pain and whose abdomen is soft to the touch. Which component of oxygen transport to the fetus could potentially be compromised by this bleeding? Option A, affinity. Option B, saturation. Option C, delivery. The correct answer is option C, delivery. Question 3. What is the most appropriate physiologic goal for a patient whose tracing reveals a sinusoidal baseline? Option A, maximize umbilical circulation. Option B, maximize uteroplacental circulation. Option C, reduce uterine activity. The correct answer is option B, maximize uteroplacental circulation. Question 4. When recurrent late decelerations are occurring, the correct physiologic interpretation of this event is: Option A, fetal myocardial acidosis is occurring. Option B, fetal hypoxemia may be present. Option C, the fetus has oxygen reserves. The correct answer is option B, fetal hypoxemia may be present. Question 5. Which intrinsic homeostatic response is the fetus demonstrating when abrupt variable decelerations are present? Option A, baroreceptor. Option B, catecholamine. Option C, sympathetic. The correct answer is option A, baroreceptor. Question 6. An amnioinfusion is intended to relieve which extrinsic factor that compromises oxygen transport? Option A, excessive uterine compression. Option B, structural abnormalities of the placenta. Option C, umbilical cord compression. The correct answer is option C, umbilical cord compression. Question 7. The nurse wants to document her conversation with the attending physician during an emergent situation. The best approach to documentation would be to: Option A, continue providing care for the patient and write a late entry summarizing the conversation after the cesarean is completed. Option B, enter an objective transcription of the conversation in the electronic record while colleagues are preparing the patient for surgery. Option C, report the conversation to the charge nurse, who can make an entry in the medical R. The correct answer is option A, continue providing care for the patient and write a late entry summarizing the conversation after the cesarean is completed. Question 8. An infant was delivered via cesarean. Umbilical cord blood gases were pH 6.88, PCO2 114, PO2 10, bicarbonate 15, base excess 20. The initial neonatal hematocrit was 20% and the hemoglobin was 8. Which interpretation of these umbilical cord and initial neonatal blood results is correct? Option A, base buffers have been used to maintain oxygenation. Option B, the mother was probably hypoglycemic. Option C, the neonate is anemic. The correct answer is option C, the neonate is anemic. Question 9. An infant was delivered via cesarean. Umbilical cord blood gases were pH 6.88, PCO2 114, PO2 10, bicarbonate 15, base excess 20. The initial neonatal hematocrit was 20% and the hemoglobin was 8. These umbilical cord blood gases indicate: Option A, asphyxia related to umbilical and placental abnormalities. Option B, hypoxia related to neurological damage. Option C, mixed acidosis. The correct answer is option C, mixed acidosis.